Okay, so good afternoon, everybody. Juliet will continue to let people access as we go along, but I'm just going to make some introductions. Thanks very much for your time today, and welcome to our webinar where we're presenting the findings of phase one of our study, evaluating the implementation of digital social care records, or DiSCRE for short. My name's Joanne Westwood. I'm a professor of social work education at the University of Central Lancashire and one of the co-lead investigators for the study. My colleagues who are here today, who are undertaking the study, will introduce themselves as we go through the presentation. You'll have noted when you joined that the webinar is being recorded. And so if you don't want your voice to be recorded, please use the chat function for questions or comments. When we share the recording of the webinar, we won't be including the recorded section of the Q&A session at the end. Can you just move to the next slide, please, Juliet?
Have I moved everything off the screen? Is that okay now? You can just see the screen.
Yeah.
It's all fine. It's all fine.
Yeah, just needs to move to the next one. That's great. Thanks. Thank you.
On now.
Thanks. So this study is funded by the NIHR, who are acknowledged here, along with our colleagues, Tamsin Walker, who's supporting co-production, and Joe Ward, who's the administrator for our project. We would really like to thank the clinical research networks we've been working with for the last few months for their help and support as we've gone through the study. Particular thanks also to the Evaluation Advisory Network for their contribution to the design and development of the study, and to the provider organisations for their participation in interviews for phase one. And I'm now going to hand over to my colleague, Juliet.
Okay. Hello, everyone. So my name is Juliet Malley. I'm based at LSE. I'm the co-director of SOCRATES, and I'm also one of the co-principal investigators along with Joanne for this project. So before we get on to the interesting bit, which is why I'm sure you're all here to hear about the findings, I'm just going to give you a very brief overview of our plans and what we've been doing over the last sort of 5-6 months or so. The aim of the project itself was to generate evidence that's going to help organisations implement digital social care records in a way that really delivers the greatest benefit for the most people. So recognising that actually now rollout has really advanced quite far, what we're really looking at is thinking about how we can get the most out of those records for everyone involved. So we've worked across 4 sites in the country. It might be a little bit small on that diagram, but South Cumbria and Lancashire is one, Nottingham and Nottinghamshire, 2 areas in London, so South East and South West, and Dorset. We've worked with 30 providers across those areas, and so that includes adopters and non-adopters, care homes and home care organisations. Throughout the study, we've been working with our evaluation advisory network. I think some of those people are on the call today. That comprises members of the public who have an interest in digital social care records, also people working within provider organisations and other key stakeholders. And they've really been advising us on our plans for the study, helping with development of the research materials and interpreting the findings from the work. So they've been a really key part of this work for us. So there's several phases to the study. What we're going to talk about today is phase 1, which we're just completing now. So that involved interviews with managers of the 30 care provider organisations that I've mentioned, also interviews with suppliers of digital social care records. We're just going to talk about the findings from the interviews and managers today. We're still sort of ongoing with a couple more interviews for the suppliers. So we will pick that up next time we do one of these. And so I just wanted to mention that because this is a rapid evaluation, we've been using rapid methods for analysis, but also a key part of the way we're working as SOCRATES is making sure that our findings are relevant. That's part of the reason for it to be rapid. So what we want to do and what purpose really of today is make sure that we're feeding back our findings early and as frequently as possible so that the work can be as useful as possible to you. So right now I will hand over to Nicola, who will go through the next part of the work. Oh, sorry, I've got to admit people. I can't talk and admit people at the same time. Right, are we moving on?
Thanks, Juliet.
Okay. Sorry to those people who are just arriving. So, okay, so this just gives you an outline of what we're going to talk about. So Nicola will talk about the first slide part of that now, and I'll hand over. Here we go.
Okay, brilliant. So yeah, I'm Nicola Farrelly. I'm one of the researchers on this study. I'm based at UCLan, University of Central Lancashire, which is in Preston in Lancashire. So I'm going to run through what we've learned from speaking to care managers about why is or isn't adoption happening. So what we found out about why are people adopting, we found that managers had various expectations about what digital care records will deliver in terms of benefits. Managers told us that they're adopting digital care records because of expectations around benefits to clients, to their staff, and also to the organisation as a whole. So firstly, in relation to the wider organisation, so managers told us that they often hoped that digital care records would help them to comply with CQC regulations or the Care Quality Commission. So that would include things like improved record keeping, improved adherence to GDPR. And this quote here, I'm just going to read this out in the green box. So one of the managers said, "I could clearly see our weaknesses as a home. A lot of paper records and a lot of sheets flying around, going missing, and it's not a good way to keep track of the items." So some felt it would be easier to pull reports with accurate data that can monitor the impact of activities and also evidence their care delivery. Some hope that digital care records will make it easier to share data across health and social care. So, for example, via linking in with GP Connect, district nurse systems, and hospital passports. Secondly, the expectations for staff. One of the most frequent benefits that managers hoped for was that digital care records would save time for care workers. If staff could record care plans in real time, it would mean that hopefully they could spend more time with their clients. And some also hope that the speech to text or the predictive text function on digital care records will be helpful for staff who don't speak English as a first language, but also staff with dyslexia or dyscalculia or other difficulties with reading and writing. And thirdly, expectations for clients. So some managers said that they hope that digital care records would improve the client safety. So, for example, through prompting carers to check blood sugar levels or lock medicine cabinets before signing out of the home care visit. Others thought that certain features of digital care records would help to better reflect clients as individuals. So, for example, uploading images to their care plans. For example, how somebody likes to have their bath, how to position their wheelchair and so on, but also information about individuals' friendship circles, what they like to do and so on. Some thought that digital care records would help to empower clients to be more involved in their care. So, for example, through the patient and the family portal and giving them more visibility of their records. We also found out about some of the wider contextual factors influencing decisions to adopt. So, for example, there was a strong sense of pressure from government and also the CQC to adopt digital care records. Some providers told us that they had heard they couldn't achieve outstanding if they didn't adopt, and others were worried about actually getting shut down if they didn't adopt as well. So some managers were telling us that they felt that their hand had been forced on the decision about whether to adopt or not. Cost savings were rarely mentioned as an expected benefit. Managers usually assumed they would break even and saw the potential of digital care records elsewhere. So, for example, savings in time over cost. Yeah, and what we found out about why aren't people adopting? So we found that there were some concerns about negative consequences of digital care records. So, for example, managers who weren't planning to adopt, when we spoke to them, were concerned that digital recording will take the personal touch out of care delivery. So, for example, staff ticking off breakfast from a drop-down menu rather than recording, for example, what clients had actually had. So if you look at this pink speech bubble here, one of the managers said, is it going to just look like this pre-typed, pre-populated situation? Is it going to give us that real insight into the individual? Some also talked about safety concerns, which were linked to competition between providers that prohibited data sharing via the digital care record. So, for example, we found one incident where a daytime home care provider that was recording care in the digital record rather than in the books in the client's home had forgotten to give someone their medication, and the evening provider wasn't able to see this error as they didn't have access to the individual's digital social care records. So therefore, there are some potential data security issues. There's also issues around digital skills among staff and also internet connectivity problems. And these were some of the other issues that were raised about introducing the digital social care records. But generally, managers who didn't want to adopt were quite content with their current recording practices and thought that digital care records actually carried more risks than potential rewards. Managers often accepted that digital records may bring some positives, but ultimately they judged that they weren't necessarily right for their organisation at that time. And finally, what could be better? We found that awareness of benefits, it could sometimes be lacking. Managers generally felt that while providers were being told what DCSRs are or digital records are, there's still a key part missing about why adoption is or could be beneficial. During the interviews, some people asked us to clarify what we meant by digital care records and were unaware of features such as the speech-to-text function and the patient and the family portal. For those who aren't aware of what that is the gateway for families to be able to access information through the digital care record. There was also a lack of clarity around cost savings. Smaller providers in particular told us that they would need more financial support, not just to introduce the digital records, but also to sustain it as well. There were also challenges around choosing which software to buy, and we found a lack of information and support for how to implement the digital care records effectively and which supplier to choose. And this actually emerged as one of the biggest things that would help to support digital care record adoption. Providers told us that they would like more guidance on how to be market savvy when choosing a supplier. And they talked about being aware of suppliers being salespeople first and foremost, and wanted to know that they were selecting a system that actually did what it said that it would do. And some providers told us that they actually chose a supplier based on reviews or usage by their peers in other care organisations. So the assured suppliers list, which is the list of suppliers which is recommended by government, although it was well known among managers that we interviewed, they felt that this wasn't enough information. They spoke about there being too many suppliers on the list, which could be overwhelming when they're not tech experts themselves and are also busy trying to deliver day-to-day care. And we also were told about actually some only had a few options that were available to them to cater to their specific needs, particularly in home care settings. And finally, providers were concerned about safety and data security and would feel more confident in digital care records if more data sharing regulations were introduced. So that's that for that section. I'm going to hand over to Nicole now for the next section.
Thank you very much, Nicola. So my name is Nicole Stalz and I'm a research fellow at King's College London. And I'm going to talk about the experience of going digital and the impact that it had, or as reported by care provider managers on the way they provided care services for their clients. So there are some really positive experiences that were reported to us, and those were around efficiency and transparency. So the care managers basically said everything is in one place. It really saves us time to look at how care provision is recorded. And we can be really sure that what staff is saying they are actually doing. And this can be done very easily at the click of a button. So we don't need to, especially care, home care, domiciliary care providers, we don't need to drive around, collect big ledgers of notes and then run through them. So just at the click of a button, we'll be able to run reports. They also felt that there was an increased safety of record keeping, something that they had hoped for, as we've heard from Nicola. So they said, obviously, there's all the history is available. Records cannot be easily amended or deleted, or if someone amends them, then there's always a record of that happening. Some told us that they need to go through suppliers or HQ to make these amendments. So if there was a bigger amendment needed, that was not just easy to be done. In terms of cost savings, as we heard, it's maybe not so much about making savings, but maybe that it is value for money. And managers told us that benefits sometimes outweighed higher costs, but that they were also able to make some savings in terms of saving costs on paper and printing. In terms of looking at how care was provided for clients or for residents, just again, this the ability to run a report on a client or on specific services, really, they felt that that really improved care. They said that this was more personalized, that they were able to see changes, and also that they were able to react more quickly to any incidents around medication, for instance, or if there were any accident incidents reported. And they said that automatic alerts would also remind them to run reports on a person or on the home when this was needed, not just for an audit. The other one was around the involvement of residents or their relatives. They felt obviously if they were using something like the family portal or access was available to clients and residents, that this was seen as a real positive, that this was taken on more maybe by relatives rather than clients, but they felt that this was giving them more transparency, but also more interaction and also an ability to react if relatives were asking questions. So they could look into that and react in a much quicker time, even though others reported, obviously relatives would still ring the telephone. But they were thinking this was a different way, especially if relatives were living at a long distance. Next slide, please. So where there's sort of positives, there's often also some negatives. And this, as we've also heard a little bit from Nicola already, had to do with the way that documentation is sort of done on the different systems. We heard from managers that they sometimes had the feeling that staff was not providing the sort of detail that they used to provide when they were just writing on paper. They felt that there was an overuse of emojis instead of providing sort of a narrative about how the person had been on the day or how the care had been provided. They also felt that there was sort of standardization going on due to an overuse of icons or drop-down boxes. And they felt that some systems were sort of lacking free text boxes to provide that extra detail that they were looking for, where they thought that would sort of increase the real potential of what could be achieved with digital records. We also heard that experience of feeling that the system was not fit for purpose. Three providers basically said that they felt lied to or being sold a dot about features that they were promised, but then actually did not really were provided on their system. So one example was not being able to load up pictures as part of digital records, so that they were feeling that this was really missing and would be a great positive if it would be available to them. We heard about ways of staff being able to manipulate the system. That was more the case for domiciliary care providers that were using, where staff were using their own private mobile phones, and where they were able to change the timings on it. And so if they changed the time on the mobile, it would also change the timings on the care records. We've already heard about a very dangerous example of where data sharing was just not happening through Nicolas' example. So they felt that there was a competition going on between different suppliers, digital software suppliers, not opening up their systems for others to look into that, aside from less data sharing with GPs or with local authorities that they maybe had hoped for. Some managers felt that looking at false alarms and alarms was really time consuming for them, that they needed to react very quickly to those, that was actually taking up more time than they thought. Devices, and this is maybe more an issue for home rather than domiciliary care, where they had specific devices being provided by suppliers. They felt that they were often quite expensive and prone to breaking, and also that they needed new devices or needed to buy new devices when there was a greater update. And in terms of residents or clients having access to their own devices, again, maybe more an issue for home care, just because the ledgers were not in the home anymore. Clients needed to have digital devices, and maybe that is a bit of a cliche, but not every older person has a mobile phone. Yes, we know maybe do, but not everyone was able then also to run and be able to look at that. So that was something that they thought needed maybe but just needed to look into that a little bit more to make that more inclusive again. In terms of the journey, so we've already heard that it was difficult to find the right supplier. And that some suppliers, because of being maybe a part of a franchise or a chain, were told what systems to use, so they didn't really have a choice. Everyone almost of all, well, every manager told us that implementation is a big project to take on, that it had to do a lot with change management, that communication was really important, not only with their clients and their staff, but also with HQ, and just being aware that it takes a lot of time to digitalize existing paper records, and not everyone was able to get some support with that. We were also told that previous experience could be very positive, but also quite negative in terms of sort of perceived benefits and perceived expectations. So some people really thought that what digital records provided them was really, just ticking every box, but others just really hoped for more because they had made better experiences in the past. We heard about data security concerns and the fear of cyber attacks. We heard about the breach of the NHS system a few years back. We've just heard about it last week again. So these things happen. And also the concerns around staff using mobile phones, their own private mobile phones, and what that meant in terms of data security. And two providers told us that they had basically abandoned the system that they had initially bought or implemented, or they were looking into abandoning it just because support was not available that they had hoped for. So they had really this feeling of being let down. So what could improve the experience of implementation and sort of overcoming the challenges? Well, not really surprising, but being committed as a manager, and as I said, really explaining to staff and to clients what the benefits are and how it works, having a greater plan of how implementation will happen, training, really taking the time. And in this case, we heard that in-person training was better than having it done online. Sometimes online had to do because they implemented the systems during COVID. So obviously in-person training was really difficult to be achieved. But really importantly, taking anxiety of staff seriously and having patience and maybe providing some extra session. We also heard that staged implementation rather than implementing everything at once worked quite well. And that also gave the opportunity to pilot some systems first with some staff, maybe also with some clients, and using maybe something like a dummy client before going live with everything. As an ongoing help to implementation and use of digital records was to have some staff being sort of receiving extra training and then becoming digital records champions. And we heard that as one way of maybe abandoning a system, but really helpful to have good supplier support, or if they were part of a franchise or a chain, to have their own IT departments who were helping with training or were helping with if there were any challenges to overcome. We also heard about funding, and this was not just, or receiving funding, and this was not just around adoption, but also maybe to have that opportunity for extra training. And in terms of data security, to buy into a system that had an offline backup system and to have a contingency plan if something needed to be changed or if the internet was down. And I'm now handing over to Martha for the next section. Thank you.
Hi, thanks, Nicole. Yeah, so I'll be talking about areas of further investigation in phase 2. So maybe, Paul, this will pick up a little bit on the question I saw you put in the chat. So in phase 2, oh, I should also say I'm Martha. I'm a research fellow at the London School of Economics. But yeah, so our plans for phase 2 are that we're going to go back to 10 providers that we've already spoken to who have adopted DSCRs or digital records to carry out interviews with 30 care workers and 30 people drawing on care and or their family members. We'll also go back to 8 of these providers to interview managers again to help us better understand the business case and return on investment. As you can see, some of that came out in phase 1. There are also some features that we received mixed feedback on, as you will have heard, and we want to explore these further in phase 2. Some features were highlighted as either making it easier or more difficult to interact with the digital record itself. One of these was the speech to text and or auto correction feature. This was mentioned by a lot of people. So it was interesting that managers from the UK were more likely to highlight the speech as being useful for non-native English speakers, while managers whose own native language was not English were actually more likely to criticise it. And these managers told us that speech to text only works if care staff are literate enough to read and check the records, which in reality isn't always the case. And this was particularly mentioned in London. As an alternative, providers said that a translation feature would actually be more attuned to the needs of the sector. On the flip side, other providers told us that these features were really helpful for staff with dyslexia. Another feature was the icon-heavy interface on some of the digital records, which I think has also sort of been mentioned by Nicole and Nicola. So this icon-heavy interface on some of the digital records prioritized drop-down menus and emojis over entering narrative text. This feature was seen as being positive in terms of saving time, and it supported people whose first language might not be English, and it also made data more standardized, which helped with things like analytics and monitoring. However, some managers felt that it could make it more challenging to capture the complexities and nuances of care and clients' well-being, especially in end-of-life care contexts. So a manager who was working in palliative care told us in the orange speech bubble, if you've been totally icon-driven, how are you going to be able to stand up in court? I mean, you'd be ashamed. You have to be very, very careful with the notes that you're taking. Managers also pointed out features that they thought either supported or hindered the ways that care was delivered. The sign in and sign out function for home care was often problematic. For example, some staff had found a way to say, this is in one case, so some staff in one home care provider had found a way to say that they had done longer visits by changing the time on the device itself. Other home care providers struggled with staff forgetting to sign out of their visits, and then they couldn't amend the system, and this especially happened when they had nighttime staff. There was also one example of a supplier not being honest about the digital record, not being able to alert managers if home care staff didn't sign into a visit on time. And this was a safety issue for that particular manager because some of the clients needed insulin and medication like that. The ability or lack of ability to upload photos and images to the digital record was also mentioned a lot. Managers expected that this would be a feature in a lot of cases, but when they installed the digital record, they realized that it wasn't. And consequences of not having the capacity to store images included making it more difficult to evidence care delivery and making it harder for clients with learning disabilities to understand their care plans. There were a lot of different views regarding the patient and family portal as well. Only a few providers are actually currently using the portal, and some didn't know that this feature existed. Most managers did think it was a good idea, saying it could help clients and relatives be more involved in their care and independently access real-time information. However, many had concerns, which included making sure that staff were properly trained on the digital record before turning on the family and patient portal. So one person said in the screen speech bubble, you don't want them, i.e. family members, accessing incomplete or poor records because that can create anxieties. And others didn't think that blanket family access was a good idea, as clients' different views on who should or shouldn't have access to their records. Someone said, where there's a will, there's a relative. And some thought access should depend on the type of care being received. So if care is becoming palliative, relatives may understandably want to see more detail. And some managers thought that as the client and family base is usually older, if they were given access to everything all at once, it could be a bit too overwhelming and they might just not use the digital record at all. So they thought it was a better idea to introduce into the portal one item at a time. And one manager told us that their digital record had helped them to support trans and non-binary people. When a client in their organisation transitioned, it only took managers a few minutes to change their pronouns across all of their records in the digital record. Care staff who had previously been struggling to remember the client's pronouns suddenly started using them correctly overnight because they were standardised across the system. And finally, the ability or lack of ability to evidence signatures showing client and family involvement was also raised multiple times as an issue with the digital record. These are some of the themes then that we want to look at in more detail in phase 2. In terms of equality, diversity and inclusion, or EDI, particularly in terms of the speech-to-text and predictive text features, we want to have a look at how these might be supporting or not supporting non-native English speakers and people with dyslexia, as well as the potential for digital records to support trans and non-binary people and people from other backgrounds. We also want to look at interoperability of the digital record with other systems in more detail. So views on sharing data with systems used by other organisations, particularly healthcare, were often negative in the interviews we've done so far. So some managers felt that social care data benefited the NHS more, and data sharing with the NHS often felt like a one-way street. Others pointed out that the NHS is one organisation, whereas for social care providers, market competition makes data sharing less beneficial. Some people felt that social care is being pressured to jump through hoops to share data with the NHS by creating NHS mail accounts, for example, when a couple of providers told us that they know that NHS colleagues they interact with don't even have accounts. And one provider told us that the 2 GP surgeries down the road have systems that can't even speak to each other. So how are DSCRs or digital records going to fit into that picture? People generally felt overall that it seemed like too much blue sky thinking without considering the complex reality on the ground. Other systems we want to look into further in phase 2 are how digital records can link in with EMR, or electronic medication administration record systems, rostering, analytics, and software like GP Connect, which facilitates data sharing across different social care and healthcare providers. We also want to look more at safety and security issues. So while many people told us that digital records have improved safety for the clients, which is important to know, as mentioned earlier by Nicole and Nicola, there have been issues related to data sharing between providers via the digital record that have left home care clients with missed medication. This is a serious safety concern. And we've also heard mixed views around equipment and GDPR. For example, some managers said that their staff prefer to use the digital record on their own mobile phones, while others prefer to use devices provided by their employer. And then suppliers who we have interviewed in phase 1 have told us that their devices are 100% compliant with GDPR, which is why they recommend that people use them. But providers, on the other hand, have told us that they struggle to afford these devices and they can be prone to breakage. We also want to look, finally, into costs and benefits in more detail. So we've heard mixed feedback, as you will have heard, on whether implementing digital records actually brings about cost savings. Early adopters were more likely to have seen financial savings, particularly after they digitised other systems and made them interoperable with the digital record. However, some managers told us that the digital record is a huge burden in terms of time and workload, often one that they hadn't anticipated before they installed it, and sometimes it doesn't work. And so some, as Nicole said, have already switched or are considering switching suppliers, which is another substantial financial investment. But generally, managers seem to feel that while cost savings may be negligible, digital records did bring huge benefits elsewhere, for example, in improving care quality. And they really emphasised that. And some said that you can't put a price on that. So ultimately, the general consensus was that it was still worth it. And I am now handing back to Joanne.
Thanks very much. Thank you to Juliet, Nicole, Nicola and Martha for your presentations of the key findings of phase 1 and plans for phase 2. So we're now opening the floor up for questions. And as I said before, if you've got any questions, if you just indicate, we'll try and respond to those. There's already a couple of questions in the chat, so feel free to pop those in as well. First question I've got in the chat is from Paula Green, who wants to hear more about the integration of DCR with other digital projects. And I think we've just had some response from Martha about that in terms of phase 2. I don't know if you want to ask a little bit more about that question, Paula.
Well, I feel that we covered it, but it's certainly been an interesting area, especially for the early adopters of systems, who now find, the digital world has moved on so much. Is the DSCR actually keeping up?
Okay.
It's just something we're experiencing a little in ICB South West London, and I think it's actually making the providers, the suppliers, work together more and actually, move out of those silos. So I think it's been a bit of a wake-up call, all the systems that we now are getting involved with, like email, remote monitoring that we've got in South West London. A home does not want to have to duplicate information, and that's a key driver. So it's certainly interesting. It'll be interesting the findings from the next phase.
Yeah, thanks, Paula. And that's good to hear about the providers starting to kind of talk to each other more. That's really going to be helpful, I think, because that is something that has come up in terms of the data sharing issues for us.
And there's lots of some of the smaller ones that they just haven't been able to keep up with the investment, I think, that's needed to have some of these integrated platforms. So you obviously get your forerunners, don't you, the larger companies that we all know of. So it'll be interesting going forward.
Yeah, thank you. Thanks very much, Paula. Jennifer, you wanted us to give a feel for the proportion of positive feedback and challenges. So I'll hand that over to perhaps Nicola or Martha or Nicole to say what you think about that. Nicola.
There were definitely, in terms of proportion, we'd have to go and do some quantitative analysis of the data that we've got. But I think just off the top of their heads, when we've been having our sort of data sort of analysis discussions, I think there are particular areas that providers feel more positively about. And bearing in mind, we have only spoken to the managers at this stage. And, you know, some of those things that we've reported back in relation to, you know, the time that's taken to actually move over, and feeling that that is potentially an issue, but also the support that is provided by the suppliers can really sort of help in that sort of transition. And I think that was kind of a general theme, an overarching theme from the discussions when we brought together all of the information we've had from the different sites. So yeah, in terms of being able to give a proportion, I'm not sure we can give an accurate answer at this stage, but they're definitely the themes that we've presented here seem to be quite common. You know, managers feeling as if, you know, this is really gonna sort of enhance care relationships, for example, by reducing the amount of time that's needed to record, in terms of accuracy of recording. You know, if staff are able to do it there and then rather than at the end of the shift when they're tired and they've forgotten about information, that's going to produce much more accurate recording. So there are these sorts of things that, you know, generally managers are feeling really positive about. And then the other things that people are feeling less positive about is the the idea of, you know, are we choosing the right system? Is it going to be fit for purpose? What are our options? Training was definitely beneficial, but not always suitable for staff who were less skilled or confident at using technology. Yeah, I don't know if Martha or Nicole wants to come in and say anything additionally.
Nicole?
Yeah, maybe one aspect. I think it's also whether you had implemented a while ago, you know, being an early adopter or just having really years of experience with the digital system compared to those who just very recently adopted it. I think for those it was really about, you know, it needed to settle in. I think the sort of the challenges were much more at the front of their you know, thinking at the time of the interview. I remember one of my interviews saying, oh, you know, if I just tell you how it's all great, but actually, if I now look back, I think I look at this with sort of rose-tinted glasses. You know, I need to be honest, it was a huge job, but it was worth it. So I think that was, yeah, you maybe needed to get to a point where you knew what you could get from the system, but also maybe, you know, what you couldn't get. And we heard about people, you know, making sort of their own adaptations to some systems. Where that wasn't really provided by the suppliers.
Okay, thanks, Nicole. Martha?
Oh yeah, so I would say something quick. I think something that really struck me when we were talking in our data analysis sessions was that I think at one point when we were looking at all of the people we've interviewed, and yes, there's been a lot of challenges, some people have had more than others, I think only maybe one provider would have said outright, you know, I wish I hadn't ever implemented. But again, that's all kind of to be taken with a pinch of salt because we haven't actually gone through all of the transcripts at the end and the quantitative analysis or anything. But I think that was something that really stood out to me. Okay,
thanks Martha and Nicole and Nicola. Jennifer, I hope that answers your question. It's not a straightforward answer because it's so nuanced in many respects.
Yeah, no, that is really helpful, and yeah, that is very pertinent. The point about, you know, where the provider is on their journey of using digital records. I could see that would make if you're in the thick of it, you're probably not going to be as positive about it as someone that's been using it on a mature basis for 2 years. So yeah, that does make sense. Yeah.
Okay, thank you. I'm going to move us on to the next question. I've got a question from Jenny Burton in the chat, and this is about how other professionals who are interacting through their visits to care homes or people who are drawing on services are using the records. So we're going to be looking at that in phase 2. Jenny, do you want to just sort of explain your question in a better way than I have?
Yeah, I guess it's just I'm a clinical academic geriatrician based in Glasgow, and I do a lot of work with care homes, and they've spoken about sort of, obviously they've got all the challenges of supporting their own service to switch to digital, but then are finding that visiting professionals either aren't prepared to, even when they have the capability to allow them to record their instructions, their contemporaneous notes, they either won't do that and need a member of care home staff to document on their behalf that introduces issues, or just, obviously it's an issue about multiplicity of systems, but it's just interesting because it seems to be that a lot more work comes back to the care homes despite them, I guess, having the better system. but where normally they would have maybe put pen to paper and written a note in a kind of paper-based record. So just trying to understand, some of the software doesn't offer the functionality for people to do that, which again, issues with ownership. So,
okay. Martha?
Oh gosh, yes, sorry, I'm not sure I've completely got the question. I don't know if someone else wants to go first, to be honest.
I was thinking about, I'll come in because I was thinking about what this will be a really interesting and really applicable area to look at when we're going back to speak to staff in the homes in phase 2. We'll definitely explore that around whether they've come across this request to record directly into them. Off the top of my head, I know that from the phase 1 of the interviews, talking to managers, I think they sort of mainly talked about pulling information off to share with visiting professionals. And yeah, it being limited in some certainly said it being limited who can access it to actually input information into the systems, but that's not by any means across the board. So I think that would be really useful to investigate, the confidence around that as well, and how that can, how that can work, and possibly that can be something that we explore with the suppliers as well about that functionality.
Okay, thanks, Nicola. And the other bit of your question, Jenny, so I'm just trying to kind of keep things moving along because we're quite short on time, was about the other people, staff using the phones and devices, and what the people who draw on care services think about that. And I suspect, and Martha, you might want to confirm this, that'll come out of some of the interviews with people who draw on services or their families.
Yeah, sorry, I'd had a mind blank. Yes, it's all come back. So yeah, one thing that we definitely heard in phase 1 was that loads and loads of providers said this, that relatives and mainly clients were concerned that staff were using their mobile phones, and that was a really big thing for a lot of especially care homes. So they did different things, like by putting like coloured cases on their devices, so it was quite obvious that they weren't the mobile phones. But some providers were saying, and it's actually got to the point where it's quite demoralising, because people continuously still think that staff are on their phones, and no matter how many times you try and tell them otherwise, it is difficult to really get that across. So that's what came out of phase 1, but it's definitely something we can look at in phase 2. Yeah.
Thanks, Martha. And Mary, you're asking about if we'll be looking to include feedback from visiting health professionals to care homes who are tasked with navigating the various systems. No, I don't think so is the answer, because I think we're asking people who draw on services and the staff who work in the care homes or for the care providers. But that's something that perhaps we can ask about, perceptions of other professionals or what their roles are. Okay, so I'm going to move on to a question from Zoe, which is about the rapid evaluation and the audience we've got here in the room today. Yes, there's lots of other plans to disseminate, Zoe. This is just the first stage of a dissemination strategy, just looking at the phase 1. And because it's a rapid evaluation, we'll be done and dusted by March next year. So there will be another webinar in a similar format to this, plus other ways of disseminating. So yes, I can assure you of that. Tabitha, you've got a question about our understanding of communities of practice within our provider samples. And I'm going to go back to our research fieldwork team to respond to that. I don't know if Nicola or Nicole or Martha have got something to say. Maybe not.
Can I say the context in?
Yes, please,
Tabitha. Why I asked that. I found it interesting to hear about the competitiveness between multiple agencies working with an individual client or groups of clients. And one of the things that we've been looking at, or we did try to set up communities of practice, and in my previous role, I was aware that there was this sense of competition between providers. However, through our early phases of dispersing grants, we tried to set up communities of providers simply by transiting them through the process at the same time and inviting them into regular meetings. And that was sort of naturally helping with communities of practice there. But in terms of solution-focused communities of practice, I'm now looking at, is there a gap, is there a need? And also, would there be cooperation between providers in an effort to sort of understand whether or not we should, reattempt to set something up like that, with a solution focus to the community of practice. But I thought that was very interesting when you said about the competitive element, because it's nearly 3 years since I was in my last post, and I'd actually forgotten about that element, because obviously the majority of the people are from private enterprise, and it might not necessarily be the carers that don't want to share. It could be directives from above. So I just wondered if you'd come across any kinds of communities of practice within your provider groups, and if so, were they specifically related to the digital solutions? Or, I mean, this is discounting forums, obviously, because they do meet in forums, but that's not necessarily the same kind of thing that I'm referring to. Or if there was any others that you possibly had come across.
Maybe I'll come in here. I mean, we had obviously providers who were part of a chain or part of a group of care homes, and they said that they had sort of split up, for instance, piloting different features, or also done it in a staged approach. So care home would implement half a year before another one, so that they could learn from the team, from whether that was manager or staff, from the experience that had made, not making the same mistakes again. Peer learning, basically. I've not really come across, and I don't think my colleagues have really come across sort of shared learning where they weren't part of a group or a chain. But it's probably also not something that we really asked about. We asked about training and who had provided it, but that was more looking at suppliers or within the team.
Thank you. Yeah, I mean, it's such a fragmented sector, and to have a collective voice, then one would hope that there would be cooperation and collaborative practice where possible, but that sense of fiscal competition can often stand in the way of that. But that's very interesting to know that within chains that they'd kind of had a bit of a division of labour, so to speak, and then coming together to share their findings. Thank you for that.
Thanks very much. Thank you, Tabitha. Jenny Burton, do you want to just quickly summarise this question? I think it might be for Juliet if it's about suppliers, but I'm not quite sure about the context of the question.
Yes, it was just to see whether people were aware about the wider plans. So obviously the focus so far has been about within care home benefits of the data, but clearly there is a national ambition, and the reason the DHSC have given care homes money to go digital and make the sector digital is because they want data. So it was really just to see what awareness there was of that context on the ground, because as well as we've had to do it, there's also going to be someone's going to pull the data at the other end.
Yeah, okay. Juliet, do you have a response to that one?
I mean, not from the perspective of the care manager of providers, but from the digital suppliers that the interviews I've done. I mean, they're not extensive, the number that we've done. It's only a couple so far. Yeah, I mean, that's definitely part of what they're thinking about, and they're engaging with DHSC around that. But yeah, I'm not sure about on the ground. I don't know, colleagues, if you had that was mentioned at all.
I mean, the London shared care record, and I think there's a similar one in Dorset. These were the sites that I was looking at. A lot of people had never heard of them before. I think one provider I spoke to had mentioned that as something that they wanted to do in the future, linking in with their digital social care record. And yeah, I personally was quite surprised at the yeah, the kind of the lack of awareness there, as the policy is obviously quite clear. When we were doing the policy context at the start of the project about what the government really wants to get out of digital social care records in terms of them linking that in then with the shared care record, and yeah, and but then actually on the ground, it's not, the message definitely has not been received for whatever reason. But I don't know actually what Nicole and Nicola thought of that. If you had anything at all.
Well, we'll just move on. We've only got a couple of minutes left. Thank you. Thanks for that, Martha. And Zoe, you're asking about the proportion of adopters and non-adopters in care homes versus home care. We've got that data, obviously. I don't know if we've shared it at this stage. Have we got it in front of us? Can any of you researchers tell us that?
I think we were about what we had hoped in the beginning, which was sort of a third non-adopters and then a third sort of in the middle, you know, just in the process of adopting, and then a third having adopted for a while. And then we were aimed for about half home care and half care home. We have slightly more care home than home care, probably slightly fewer non-adopters in the end, but it's pretty much broadly.
Yeah, what we'd anticipated. Yeah, thank you. Thanks. Hope that helps, Zoe. And finally, just a point and a reflection from Jenny. Thanks very much for your contribution. It's been very helpful. Talking about surfacing strategies from homes about how to make digital recording acceptable as a form of care home work versus the traditional sitting at a desk with a large folder. And I guess that goes back to the point of what people are doing, what staff are doing, or what they're perceived to be doing when they're on their phones inputting data, I guess. So yeah, that's a helpful point. I don't know if there's any more questions that anybody's got. There were no more questions in the chat and we're just about out of time, but can you just move the slides on, Juliet? I think there's just a final slide we need to just cover, which is, do you want to take this one now, Juliet?
Yeah. So just a summary really, just to let you know where we're going next. So Martha's taken us through the features and themes that we decided we wanted to look at in a bit more detail, and definitely take on board as well the points from the discussion today about you know, the visiting professionals, which I think is really important. So as you heard, you know, we've really spoken at this point just to care home and home care managers. So the aim is really about getting other perspectives on this process of implementation. As we mentioned, that's really from family and also from people who are drawing on those services, might be residents in care homes, and then the care workers themselves. Obviously, there are many more perspectives you could draw in, but you know, this is a rapid evaluation and we have a limited amount of resources, and that's sort of where we've chosen for the focus. I think the key thing to mention here and rationale for that is actually sort of hasn't really been much attention to friends of sort of family and the people who are drawing on the services yet. So I think that'll be a really important perspective to bring in, particularly as they do have particular concerns around security and so on. So as we mentioned as well, we're really wanting to look a bit more into the business case and return on investment, and getting that perspective from the providers as well tends to have been a bit of a sort of treasury perspective on this. So really important to hear that case from the providers as well, so we can kind of try and marry up those different views and perspectives. So in terms of what's next then, feeding back, we will have another webinar like this later this year, which will feed back on the phase 2 findings. So yeah, really watch this space. If you have any more questions about what you've heard today, or just want to get in touch for any other reasons related to the project, then do get in touch with either me or Joanne. We've got our emails here, so hopefully you can jot those down. But yeah, we'd love to hear from you, any thoughts you have on what we've talked about today. So thank you. I think, well, maybe I'll pass over to Joanne to do the thank you.
Yeah, thank you. Thanks very much, everyone. Thanks for our presenters for your contributions today, and thank you for the questions and comments. They've been really helpful. Just to let you know that a summary of the key findings presented today will be sent out to everybody registered, and we'll be in touch with the next webinar at some point. Thank you all. Thanks very much.
Right, I'm going to end it now for everyone. Bye-bye.
Okay, thanks, Juliet.